Now, just as a disclaimer, I have personally not seen a patient with Ebola as such, but I've read about what patients with Ebola undergo, and the different controversies include, first off, diagnosis. I mean, did you get the right diagnosis? Are you missing a second diagnosis underlying, say, such as malaria or a regular influenza infection, for example? And with the oncoming flu season, we might be facing more of that. The next aspect is once you have diagnosed them, where do you put them? So the questions are, do they need to be treated at home? Do they need to come to a hospital? If your hospital doesn't have a separate isolation unit, do you shift them to a larger center that has that? So those are some of the controversies we've seen. But specifically in terms of the pathophysiology of Ebola, how do you actually manage them? One of them is fluid resuscitation. We've heard from some of our colleagues, for example, Dr. Connor from Emory, who's a nephrologist and intensivist, was mentioning that he prefers not using chloride-containing solutions mainly because of the side effects of kidney injury, and that's an ongoing area of intense research. So we really don't know for sure if that's the right or wrong approach. In addition, you're going to have a situation where a patient with Ebola is going to have asystole or he's going to require CPR. Do you do it? So those are ethical considerations which we need to really think about. So and the other aspect is, do you use antibiotics in these patients? Again, empirically, many places have used it. Some places have not used it. And the theory behind that is that if your blood cultures are negative and if you have a patient with significant GI mucosal integrity loss, which is causing secondary bacterial infection, would you need to use antibiotics? Again, a controversial area, but many places have opted to use it. So these would be kind of the key areas which I think are going to be questions. And of course, lastly, when is an Ebola patient considered cured? At this point, I think we're thinking that once their lab parameters are normal, we would say that, but there is good data that the Ebola virus does retain in certain body secretions for a while, so you need to kind of be aware of that. You can quickly get information on all of these topics by looking at the CHEST website and also through the official websites of the CDC and WHO.